Rehab Management, the interdisciplinary journal of physical rehabilitation. The Amputee Coalition of America has put legislation before Congress that would improve the outlook for amputees who are too young for Medicare and who lack adequate insurance of their own. On March 13th, the coalition's counterattack, House Resolution 5615, made its way into Congress, calling for the federal government to mandate parity for prosthetic care among insurance providers. Paddy Rossbach, Chief Executive Officer for the Amputee Coalition of America, says the bill would give amputees access to a range of devices that include even myoelectric prostheses and other advanced technologies. She says the foundations of the bill are linked squarely to need and medical necessity.
You have to base your programs on your patient. You just don't treat everybody the same as you treat somebody in the military, but that's what physical therapists and physiatrists do. They tailor a program for an individual based on their physical limitations or their physical health problems. Putting people, sitting them in a wheelchair and just leaving them with their legs dangling down on the ground and not doing anything is going to land up with them losing the second leg.
The legislation would revise coverage for what is now a small portion of the total amputee population. But Rossbach says it is a population that would simply be stuck without the protection. She says provisions for repair and replacement are included in the bill and emphasizes that it would make the one prosthesis for life policies that many insurers try to enforce a thing of the past.
Imagine if you had a child born with bilateral fibular hemimelia, 8 months old, 7 months old, they had both their feet amputated, and everybody said, oh, we'll fit you with prosthesis, and your kid will never know the difference. And then at 11 months, the mother trots along with this beautiful baby on her lap to go for the first fitting, and she walks in, and they do an assessment, and they say, well, I'm terribly sorry, but your insurance company will only pay for one prosthesis per lifetime. The only coverage they're going to get is one probably 8-inch high prosthesis with a size 0 foot for their life. It's ridiculous.
One of the deficits in amputee care that sparked H.R. 5615, Rossbach says, is the short-term view adopted by most insurers. Many companies who do provide prosthetic coverage package it as superficially as they can and hope the burden of prosthetic care sooner or later will pass to someone else.
They're not interested in what's going to happen down the line. They're not interested if enabling this person to do all this, they're going to be inactive and they're going to be at risk for diabetes. If they're sedentary, they're going to become at risk for colon cancer, bone loss, muscle loss, depression, all the things that go along with sedentariness. They're not interested in that because, for them, they don't know. This person might move, might get another job. They might not even be insuring them next year. So who the hell cares what the cost is going to be down the line? It'll be somebody else's responsibility.
H.R. 5615 is also a response to the argument used by insurance companies that prostheses artificially inflate costs by prescribing unnecessary advanced technologies. Rossbach says medical professionals generally are responsible and reasonable in the prosthetic technology they assign to an amputee. Rossbach maintains that the decision about what prosthesis is appropriate should lie in an accord between the physician, prosthetist, and patient, rather than in the policy meetings of insurance firms.
Some people think that if you're my age, you should be put in a rubber foot and a sock, and that's it, because you're this elderly woman and you can't do anything, and they don't expect that you're going to be doing what I do, and I would take great exception to that. So, but an insurance company might look at this and say, okay, she's 70 years old, she shouldn't be wearing, a flex foot or whatever else it is. But they don't know me, but my medical professional knows me.
5 members of Congress now stand behind the bill, and 9 state legislatures have passed their own version of the law, building credibility for the proposed measure at the federal level. With Congress currently preoccupied with the buzz of the approaching presidential election, H.R. 5616 may face an uphill battle for attention and support. Despite the distractions, Rossbach feels the bill's comparatively small funding, joined to the fundamental good of the measure, which is likely to shine on the legislators who support it, may be enough to carry it into law. And though the cost of the wars in Afghanistan and Iraq are draining federal budgets dry, Rossbach says those wars, ironically, may be what ultimately carries the legislation to success.
I mean, I think it has definitely brought it to the forefront. I think it's definitely showed people what can be done if you have the right care. And I have to applaud the military for the programs that they have to get people back to this stage. It is absolutely incredible.
In addition to ongoing advocacy efforts at state houses around the nation, the Amputee Coalition of America is organizing a National Week of Action April 26th through May 2nd to continue the drive behind H.R. 5615. For Rehab Management, I'm Frank Long.